So complete remission means that after an initial course of chemotherapy, which is generally an intensive chemotherapy, the patients have no clinical signs of the disease. They have normal blood cell counts, and the percentage of leukemic blast in their bone marrow is less than 5%. So that's the conventional definition of complete remission. And complete remission is important because it's the prerequisite for cure. The problem is that if today we're able to achieve complete remission is in 70 to 80% of the patients, there are still a lot of patients who do relapse after remission. So what can we do to prevent relapse? Relapse prevention is based on, basically we have three tools to do that. The first one is the administration of consolidation chemotherapy. We also call that post-remission consolidation. In younger patients, this consolidation chemotherapy is based on the administration of intensive chemo with various treatment regimen, which all are based on the administration of intermediate to high doses of an important drug, which is called cytarabine. And with this treatment, some patients with the so-called favorable cytogenetic risk AMLs can achieve a cure. But for the majority of patients, this treatment is not sufficient. And for these patients, we indicate the realization of an allogeneic stem cell transplantation, where the patient will receive a chemotherapy treatment with or without radiation therapy, followed by the administration of hematopoietic stem cells coming from a donor. And allogeneic stem cell transplantation is able to cure most of the patients who are in first complete remission of their acute myeloid leukemia. But the problem is that allogeneic stem cell transplantation is associated with a lot of toxicities, and it is not always, which make it not always applicable to older patients. And the other limit for allogeneic stem cell transplantation is also the availability of a donor. So the alternative, which has been recently developed for AML, is the administration of what we call a maintenance therapy. So that's a treatment generally with oral drugs that have a good tolerance profile and which could be administered for a prolonged period of times, that are given in patients in complete remission, and generally after the administration of 1 or 2 courses of consolidation. So the objective of this maintenance treatment is to delay the relapse or to prevent relapse. And for many years, the approaches that we have for AML were not very active. Recently, the results of an important study showed that this kind of approach could be effective. And the drug that was used is what we call an epigenetic agent, so which is working differently from the classical chemotherapy drugs, and this is an oral drug which is called CC486. And in a prospective comparative trial where the patients were randomized to receive either the CC486 for 14 days per month or a placebo, the group treated with CC486 had a significant survival advantage as compared to the other patients, showing that this kind of strategy is effective in AML. So this is an important result because the drug will be soon on the market in different parts of the world. And it also opened the way for the development of new maintenance strategies for AML patients. And to do that, we have several new agents that are currently in clinical development. They are still in their early phases, so we have to be careful in the, drawing conclusions. But different drugs with different mechanism of action and a good tolerance profile should be available in the next future and could be used as maintenance therapy for patients with AML in first complete remission.